and welcome to UCanBeHealthier TV channel. I'm your host today, Dr. Mamatha Chithriki, and today the topic will be the ultimate guide to natural migraine relief, proven tips and tricks for instant relief. So, what is a migraine and how can you find relief? Migraine headaches can be debilitating and cause intense pain lasting from hours to days. It is estimated that over 39 million people in the United States alone suffer from migraine headaches. Migraine is the third most common medical condition in the world and the second leading cause of disability worldwide. What is a migraine? Migraines are typically described as throbbing, intense headaches lasting anywhere from 4 to 72 hours. Frequently, these headaches will occur on one side of the head, but may also appear on both sides. Some people report feeling nauseous or lightheaded during and after migraine episodes. For some people, a warning symptom known as an aura occurs before or with the headache. Visual auras are relatively common symptoms associated with migraines and can include various sensory disturbances like visual patterns or lights. Knowing what can occur with a migraine attack can help you recognize what is going on. Symptoms of visual auras can include jagged flashes of light or bright spots, zigzag lines or geometric shapes in your vision, some vision loss or blind spots. While some simple visual auras are typically seen with migraines, complex visual hallucinations like those of fully formed people or animals can occur with basilar migraines or familial hemiplegic migraines. Complex visual hallucinations with hemiplegic migraine usually appear in a late stage of the migraine attack and can last hours or days. In migraines, visual hallucinations occur because the visual cortex in the brain is stimulated or because connections between nerve cells are damaged. Auras are sensory disturbances, but they are not actually hallucinations. Hallucinations are sensory experiences that can seem real, but are created by the mind and are usually a symptom of mental health disorders, such as schizophrenia and bipolar disorder, although they can be caused by numerous factors, including drug use, physical injury or illness, stress, and trauma. After a migraine attack, one might feel drained, confused, and washed out for up to a day. Some people report feeling elated. Sudden head movements might bring on the pain again briefly. What are some triggers of migraine headaches? Well, there are a number of migraine triggers, including hormonal changes in women, drinks, stress, sensory stimuli, sleep changes, physical factors, weather changes, medications, and foods. Hormonal changes in women include fluctuations in estrogen, such as before or during menstrual periods, pregnancy, and menopause. Hormonal medications, such as oral contraceptives, also can worsen migraines. Some women, however, find that their migraines occur less often when taking these medications. Drinks. These include alcohol, especially wine, and too much caffeine, such as in coffee. Stress. Stress at work or at home can cause migraines. Sensory stimuli. Bright or flashing lights can induce migraines, as can loud sounds. Strong smells, such as perfume, paint thinner, or secondhand smoke, and others can trigger migraines in some people. Sleep changes. Missing sleep or getting too much sleep can trigger migraines in some people. Physical factors. Intense physical exertion, including sexual activity, might provoke migraines. Weather changes. A change of weather or barometric pressure can prompt a migraine. Medications. Oral contraceptives and vasodilators such as nitroglycerin can aggravate migraines. Foods. Aged cheeses and salty and processed foods might trigger migraines. So might skipping meals, as well as getting dehydrated. According to the Migraine Trust, a drop in blood sugar after skipping meals, fasting or dieting, or eating food with high sugar content may trigger a migraine attack. Food additives. These include the sweetener aspartame and the preservative monosodium glutamate, MSG, that is found in many foods. What foods should I eat and which should I avoid? Eat these foods: almonds, bananas, brown rice, butternut squash, cashews, celery, cauliflower, cornflakes or oatmeal made without the added sugar, fish oil supplements, ghee or clarified butter, green vegetables, and dark leafy green ones are the best, halibut or other lean white fish like tilapia and sea bass. Of these foods, almonds are the most common migraine trigger. Celery is an excellent source of hydration due to its high water content. However, it may also trigger migraines in some people because celery contains nitrates, which can be converted into chemicals such as nitric oxide, which can cause headaches or migraines in some individuals. Which foods should I avoid? Avoid food additives like aspartame, often found in diet sodas or other sugar-free foods and beverages. Avoid monosodium glutamate or MSG, which is an additive that most people associate with Chinese food, but is also found in many packaged and restaurant foods. Avoid nitrates, especially in processed meats, sulfites, which are found in red wine, and yeast extract, which can be found in canned soup. Avoid certain alcoholic beverages like red wine, beer, and hard drinks, including scotch and whiskey. Avoid certain dairy products like aged cheese, yogurt, sour cream, and buttermilk. Avoid aged, smoked, fermented, pickled, or salted meats and fish. Avoid hot dogs, bacon, and herring. Avoid certain fresh fruits like citrus, avocados, and dried fruits like raisins. Avoid beans, nuts, and soy like fava and lima, nut butters, and tofu. Avoid certain vegetables like onions and tomato. Make lifestyle changes that can help reduce stress and ease the pain. Stress and pain can have a detrimental effect on your mental and physical health. It is essential to find ways to reduce the stress and ease the pain to stay healthy and happy. Many lifestyle changes can help reduce stress and ease the pain, such as relaxation techniques for headaches, yoga poses to relieve head pain, and stress management techniques. By making these lifestyle changes, you can take control of your life and make sure you live healthier. Try natural remedies to relieve migraines quickly. Migraines are a common and painful condition that can be difficult to treat. Fortunately, there are many natural remedies available that can produce relief from migraines quickly and effectively. Herbal remedies, home remedies, acupuncture, and magnesium supplements have all been proven to help reduce the severity and frequency of migraines. Acupressure is an ancient healing practice used for centuries to reduce pain and tension in the body. The major difference between acupuncture and acupressure is that acupressure uses firm pressure and massage to stimulate the meridians, also called acupoints, whilst acupuncture uses hair-thin needles to stimulate those acupoints. Acupressure involves applying pressure to specific points on the body that correspond with different organs and systems to balance the energy flow. Stimulating these acupressure points can help reduce headache pain and tension and improve overall health and well-being. The acupressure points on your body that can relieve headache, pain, and tension are in the face, forehead, neck, head, temples, scalp, and jaw. Herbal remedies include cannabis. Marijuana is the most commonly used herbal remedy for migraines. It has been shown to help reduce nausea, improve sleep, and reduce pain in migraine sufferers. Side effects can include a decrease in short-term memory and impaired motor coordination. Cannabis should not be used during pregnancy or by those who have a history of psychotic episodes or other mental health disorders because it may worsen symptoms of those conditions. Some alternatives to marijuana use for pain relief include engaging in yoga and meditation, which can help to promote relaxation, as well as acupuncture and osteopathic manipulation or chiropractic care, which may also provide relief from pain. Similarly, topical capsaicin cream, a natural ingredient derived from chili peppers, has been found to be an effective treatment for certain types of chronic pain. Additionally, some people find relief through physical therapy, biofeedback techniques, or even hypnosis. Now, let's go over what we have learned. What are the most common symptoms of a migraine? Well, a migraine is characterized by a severe throbbing headache that can last for hours or even days and can be accompanied by other symptoms such as nausea, vomiting, and sensitivity to light and sound. Are there any foods or drinks that can trigger a migraine? Migraines can be debilitating and painful. Whilst the exact cause of migraines is unknown, particular foods and drinks have been found to trigger or worsen migraine symptoms. For example, foods high in tyramine such as aged cheeses, processed meats, and fermented foods can trigger migraines. Alcoholic beverages such as red wine and beer are also known to be triggers for some people. Caffeinated drinks like coffee or energy drinks can also lead to headaches in some people. Does stress play a role in migraine frequency and severity? Stress is an unavoidable part of life, and for many people it can significantly contribute to the frequency and severity of migraine headaches. Therefore, managing stress levels to reduce the frequency and severity of migraines is essential. What should I do if my migraine symptoms don't improve with natural remedies? If you have been trying natural remedies for your migraine symptoms without any improvement, it is vital to seek medical advice. For example, a doctor can help diagnose the root cause of your migraine and recommend a tailored treatment plan to address the underlying issues. Always consult your doctor before taking any medications or supplements to ensure they are safe and effective. Are there any medications that can be used to treat migraines? Well, fortunately, several medications are available that can help reduce the frequency and severity of migraines. These include triptans, non-steroidal anti-inflammatory drugs or NSAIDs, anticonvulsants, antiemetics, and opioids. Depending on the severity and frequency of your migraines, your doctor may recommend one or more of these medications for you. Preventative medications can include blood pressure lowering medications, antidepressants, anti-seizure drugs, Botox injections, and CGRP monoclonal antibodies. Here are some lifestyle and home remedies you could try. When symptoms of migraine start, try heading to a quiet, darkened room. Close your eyes and take a nap or rest. Place a cool cloth or ice pack wrapped in a towel on your forehead and drink lots of water. These practices might also soothe migraine pain. Try relaxation techniques. Biofeedback and other forms of relaxation training teach you ways to deal with stressful situations, which might help reduce the number of migraines you have. Develop a sleeping and eating routine. Don't try to sleep too much or too little. Set and follow a consistent sleep and wake schedule daily. Try to eat meals at the same time every day. Drink plenty of fluids. Stay hydrated. Keep a headache diary. Recording your symptoms in a headache diary will help you learn more about what triggers your migraines and what treatment is most effective. It will also help your doctor diagnose your condition and track your progress in between visits. Exercise regularly. Regular aerobic exercise reduces tension and can help prevent a migraine. Choose aerobic activity that you enjoy, such as walking, swimming, or cycling. Warm up slowly because sudden intense exercise can cause headaches. Regular exercise can also help you lose weight or maintain a healthy body weight, and obesity is thought to be a factor in migraines. Well, I hope I have been able to shed some light on migraine headaches. Continue gathering information to improve your health and become the healthiest version of you. Tune in next time for another episode on this channel, You Can Be Healthier TV, and don't forget to subscribe. Bye for now.